Hello and welcome to this VetLit podcast. VetLit Minis are a journal club podcast on a range of topics, small animal focused, so you can keep up to date even if you just have a few minutes spare. Today, we're visiting a real passion of mine, and that is the use of and the duration of treatment with antimicrobials in dogs with pneumonia. And to help us with that, we have Dr. Erica Reineke, Professor of Emergency and Critical Care at the University of Pennsylvania School of Veterinary Medicine. Thank you very much for joining us. Have we caught you at a good time?
Yeah, this is great. Thanks for having me.
I might add that while we were organizing this recording, it seems Dr. Reineke was single-handedly dialyzing and plasma exchanging the state of Pennsylvania, or as a minimum, Philadelphia.
Yeah, we've
Um,
had a busy winter with leptospirosis and IMHA cases, so this is a
right.
nice break from that.
Yeah. And the particular reason that Dr. Reineke is here is that aside from her interests in topics like urethral obstructions and toxicities and extracorporeal therapies, she's also the lead author on a recent study entitled Clinical Course and Radiographic Resolution of Pneumonia in Dogs Treated with a Shorter versus a Longer Course of Antimicrobials, a randomized double-masked placebo-controlled study, and that was published in JAVMA. So, as an entry for you, perhaps, the duration of antimicrobials required to treat straightforward pneumonia, perhaps often aspiration in origin, is very likely lower than what we used to be taught. Would you agree?
I would agree.
You would
I
agree?
would. Yes, I would agree.
And so then, I mean, that's ultimately that's the background of your study, really, isn't it? Saying that probably we can get away with shorter courses than we were taught. There is some background evidence to say that, there's been a few studies over the last 5, 6, 7, 8 years, right? Challenging the dogma that we need to be giving 4 to 6 weeks, for example. But again, correct me if I'm wrong, but a lot of that evidence has been non-placebo controlled, non-masked or blinded, and you've entered with this nice prospectively collected data. That was the basis of your study.
Yeah, that was definitely the basis for the study. Those 4 to 6 week recommendations that I learned when I was a vet student. I shouldn't show my age, but I've been practicing for a while. Seem to be mostly based on expert opinion.
Yeah,
And yeah, I think the reason we wanted to do the study is, although there are like veterinary consensus recommendations for which empiric antibiotic or antimicrobial you should choose to treat pneumonia, there are no actually definitive recommendations for how long to treat beyond that expert guidance of
yeah.
this 4 to 6 weeks, or some people just say 1 to 2 weeks past radiographic resolution of pneumonia. So yeah, that's why we decided to do the study because, ever since I've been practicing, I've kind of questioned that recommendation because when you go to look for evidence, there just isn't any out there for that
Yeah.
recommendation.
So then, if I may, would you be happy to summarize very briefly the sort of the structure of the study and the number of patients that you managed to bring on board? Because it was a prospective study, right?
It was a prospective, randomized, controlled study. We started the study right before COVID hit. As you can imagine, that made it a little bit difficult in regards to recruitment. Our initial recruitment goals were 70 dogs. We
Yeah.
did not get or hit our recruitment, unfortunately, and we decided after recruiting 30 dogs to terminate the study for various reasons. I'm happy to go over that. But ultimately, we enrolled 15 dogs in what we call the shorter course group, where the dogs received 2 weeks of the prescribed antimicrobial after they were diagnosed with pneumonia. And then they were seen by us at 2 weeks for a clinical examination and radiographs. And then at that point, they were transitioned to a placebo medication. And
Mhm.
then we rechecked them again at 4 weeks. Or we had a group of dogs that were randomized to what we would call standard of care,
Mhm.
which was the 4 week course or a longer course of antibiotics, in which we saw them at a 2 week recheck. We did a clinical exam and again and thoracic radiographs, and they continued their antimicrobial prescription for an additional 2 weeks where we saw them again. Yeah,
Okay, so then, so yeah, two groups, 15 dogs in each, and then ultimately 2 weeks versus 4 weeks of antimicrobials.
correct.
Um,
Correct.
and then some really nice prospective capture I think it was, yeah, I think we're calling it the 2 week time point, but it was about 12 days, wasn't it? That was the theoretically when.
Yeah, obviously we had to have some flexibility because, when there's an owner attached to the dog, they have their own schedule to, come in. And so, it was 12 plus or minus 2 days. We did
Yes.
have some protocol deviations, but that was the goal to try to get them in right around slightly before that exact 2 week mark, as well as that similar 4 week mark as well. And I should say that all dog owners and study investigators were blinded to the interventional group that the dog was in. So we didn't know, what if they were receiving a placebo medication or whether they were on their continued antimicrobial treatment guideline at that 4 week recheck.
Yeah, really cool. Really cool. So then if I were to ask you what if there were one or two particular results that are most interesting to you, what would you say in when you managed to collect that data at the either the first or the second recheck? What would you say personally?
Yeah, so first off, I want to say we were underpowered to detect a difference in relapse rates of pneumonia between the two groups because we didn't hit our study enrollment goal. So all we can really kind of say is that both groups of dogs followed a similar course in regards to their clinical signs and radiographic resolution of pneumonia. We did a post hoc analysis and we found that we were only powered to detect a 50% relapse rate between the two groups. So underpowered for sure. But what I thought was most interesting from the study, the take home point being that both groups of dogs did similarly. So I think
Yeah,
that's a good take home point.
yeah,
And I think that also we were surprised at that first recheck that it was only over about half or 60% of the dogs had complete radiographic resolution of their pneumonia, or we could say 40% of the dogs continued to have changes. And then by the 4 week mark, I think it was 83% of the dogs had complete resolution, but
yeah,
there were still 5 dogs that had some radiographic changes at the 4 week recheck. But clinically, all of the dogs were doing fabulously. They wouldn't have been in the study if they weren't doing well. So I think the big take home point for me is that we should be using our clinical findings, so our physical exam and our discussion with the dog caretaker, how the dog is doing at home to kind of guide our decision making on whether we need even to take recheck radiographs
yeah.
and or whether, they need to continue antibiotics, maybe not if clinically they're doing great, it appears, things like that. That makes sense.
I'm particularly interested in that clinical trajectory because it seems to me anyway, combining a few of the recent studies, including yours, that trajectory, maybe excluding the cough, gives you the most appropriate tool for monitoring treatment response, perhaps. Because I've got the data here, so all dogs were essentially, as per the vet's exam anyway, essentially normal at that 12 or that 2 week or 12 day time point based on the physical exam. And only a couple of dogs were reported essentially a bit lethargic by the owners. So even
Yeah,
so at a relatively early stage, you've got really nice clinical resolution prior to the cessation of any antimicrobials.
agreed. Yeah, you're right. There were a couple dogs maybe that still had a cough every now and then.
Yeah, but then it's so
Yeah.
tempting, isn't it?
Yeah.
Until now, until we've got this data to say that actually, yeah, the cough essentially can persist irrelevantly beyond the clinical picture. I don't actually, people say, sometimes people will say, oh, the dog's still coughing, but actually the dog in itself is normal. And also we really want to get into it. I suspect you'd find that there's a decreasing frequency of the cough, but we don't have it. So we're just gonna, I mean, from my perspective anyway, we're just gonna be ignoring it, right? And saying the dog's
Yeah.
clinically normal, eating, drinking.
Yeah,
Um,
unless they said the coughing has gotten worse,
yeah.
right? So I think that from a clinical standpoint, those few, I can't remember how many dogs still had a cough reported at home, but not during
Yeah.
the exam. It was infrequent
Yeah.
and not of a concern from the pet owner. I think had they complained that their dog was coughing with increased frequency, that may have raised our radar a little bit, maybe.
Yeah,
But
exactly.
usually, if there's a problem in like worsening pneumonia or relapsing pneumonia, they generally had other signs as well, at least in my clinical experience. They
Yeah.
generally start to feel unwell, they start to eat less, and they're lethargic. So I totally agree with you that cough in it by itself probably isn't enough to warrant continuing antimicrobials.
Yeah. Yeah.
Yeah.
And I suppose so let alone the study results. I think while you're here, it's a pretty valuable opportunity to just ask you a couple of questions about pneumonia in general and your approaches, related, of course, but it's often the case that things move quite quickly, right? So this study published last year, but can I ask you, what are your current practices in prescribing for simple pneumonia in dogs?
Well, so again, part of the reason we terminated the trials, it seemed that the practice in our hospital was changing,
Oh yeah.
independent of doing a clinical trial, and that the overall propensity to prescribe antibiotics for 4 to 6 weeks was kind of going away anyway. So we felt like continuing the trial didn't make a whole lot of sense. But yeah, my current practice, I mean, even I feel even more strongly about it now that we finished this publication and this study, is I think 2 weeks is reasonable based on our study results and some of the other data out there. I do wonder if even a shorter course would be okay, or similar to a paper you published. Maybe there are cases
Ah,
that don't need antimicrobials. Um, but I guess I'm hesitant to recommend that before we have maybe some additional data. Although there is some anecdotal statements out in the veterinary kind of literature saying that maybe 5 to 7 days is reasonable to consider because that's a guideline that's recommended for people who have community acquired pneumonia. So I think that is a direction probably we will head in
that's what
veterinary
we're seeing.
medicine, to even shorter courses. I think that, some people are using C-reactive protein to guide treatment decisions. We didn't look at C-reactive protein
Yeah.
in this study, and I think maybe our study could support not even needing C-reactive protein and just using, again, the clinical findings of the patient to support stopping the antimicrobials or not. But I think it's reasonable to evaluate that as well. Did I answer? I'm not sure I answered
Yeah.
your question though.
Yeah, no, definitely. I'm
Okay.
interested to know how you currently practice, and I really like that thought about CRP because it falls in this group of things that we have. Every few years we get excited about something being able to predict, for example, response to treatment. And as far as I'm concerned, anyway, CRP has to a degree been and gone. Many things are like looking back in time when you're trying to justify discontinuation of antimicrobials. CRP is almost invariably raised still after the peak of the clinical trajectory, and the animal is well on its way to resolution, has a fairly predictable progression of that. It's going to carry on getting better. Meanwhile, the CRP lags a little bit and is yeah, fine. We know that it's normal within 7 days in most of these patients, but actually the clinical trajectory of these dogs can be before that as well. Same for things like, I quite enjoy tracking bilirubin in any of these septic patients, whether it's pneumonia or otherwise, and it's like looking back in time because it just peaks at 24 hours, 48 hours after the main insult. So I like that idea, and it links into another thing that we spoke about just briefly off air is how or if we even use ultrasound in diagnosing these dogs with pneumonia. And I think it's a That is a can of worms, isn't it? To try and monitor either diagnose or monitor. I'm sure there's loads more data that we can capture, but I don't think that we have it just yet. Question mark. Do you see people using point of care ultrasound either appropriately, inappropriately, too much, not enough for these kind of dogs?
Yeah, I mean, what I would say about point of care ultrasound is, at least in my practice, and I'm like an emergency room doctor in the trenches kind of person,
Yeah.
but I think I find point of care ultrasound most helpful in supporting my clinical findings. So it's usually in a patient, let's say, who's presenting for a cough and they're febrile, and maybe I hear abnormalities in the lungs,
Hmm.
crackles, or their increased noises. And then I grab my point of care ultrasound, like, oh, look, there's some B lines. And I say, oh, good job, myself. I pat myself on the back and say, oh, your physical exam was really good. And then
Yeah.
I go on to get thoracic radiographs because we know that it can't really differentiate between different types of inflammatory states in the lungs,
Yeah.
if you're
Nice.
following me. So I
Yeah.
guess I still don't think that point of care ultrasound replaces thoracic imaging to definitively get a diagnosis and or like your endotracheal wash,
Yeah.
PCR, things like that. I find that it's similar to what you're saying about C-reactive protein. I suspect similar to radiographs as well, that
Yeah.
these signs that we see in the lungs are going to lag behind the clinical improvement because it takes a while for the inflammatory process to resolve itself. And so we might still be seeing changes on point of care ultrasound or on our radiographs, but clinically the bacteria is gone,
Yeah.
right? That the underlying cause is gone and we don't need to continue treating.
Yeah.
So I find it a little bit tricky to use it to monitor my therapies, but I think it can be quite useful in the emergent setting to kind of support what clinically you think you're finding.
Yeah. To build a case for what you're hoping or
Correct.
expecting to find. Yeah. Totally. I totally
Yeah,
agree.
agreed. Agreed.
I've got a little quotation from your study, which I think is quite a nice just summary. I really enjoyed it. And to quote you directly, you say multiple layers of evidence appear to support the idea that shorter durations of antimicrobials can be used in this patient population. And so I think that's quite a nice end summary, right? And maybe, as you say, maybe we might be able to make some progress way down towards the 5 to 7 days. That would be amazing. And quite rightly, you say that we need, or it would be lovely to have some more convincing prospectively collected data to show that. But I can't help but think that we will be able to make some of that progress, some of that gap up.
Agreed. Yeah.
So, I mean, Erica, thank you so much for joining us today. It's a real pleasure as always. The aim of VetLit is to make veterinary literature both more accessible and accessed, and hopefully we've secured that in some small way today. Remember, you'll almost definitely find an article to read that interests you on the vetlit.org site. Check back here, there, or via the email updates for more. And otherwise, have a great day. And it's bye bye for now. And bye bye from Dr.
Bye.
Reineke yourself.